This is a new edition of this series of the anatomy videos. We'll continue the gastrointestinal tract. After the stomach, we have the duodenum. So we'll start to describe the anatomy of the duodenum. Here, that is the C-shaped duodenum, which is formed of 4 parts: first, second, third, and fourth. And this is the shortest and the most fixed part of the small intestine. It forms that curve which holds the head of the pancreas inside that concavity of the duodenum. The first part of the duodenum is 2 inches and it ends at the neck of the gallbladder. Then the second part will descend downwards parallel to the middle line for 3 inches. Then another curve will be done to form the third part, which is the horizontal part, and it's 4 inches. That horizontal part will be crossing in front of the body of the third lumbar vertebrae, while the first part will be at the level of the first part of the first lumbar vertebrae. Then lastly, the fourth part will ascend parallel to the middle line on the left side for 1 inch, where it ends by the duodenojejunal flexure. That is the position of the duodenum here. That part of the duodenum which ends by the duodenojejunal flexure is suspended and fixed by a suspensory muscle of the duodenum, which is formed of muscle fibers from the right cross of the diaphragm to that flexure. Let's start by having a developmental background of the duodenum. The duodenum is a part of the small intestine, the most fixed part of the small intestine, develops from the foregut and the midgut. That line is the line between both of them. When it develops, it is a solid mass filled by an epithelial mass inside the cavity of that part of the duodenum. In the meantime, it has a dorsal mesentery which is attached to the posterior abdominal wall like that of the stomach. With rotation of the stomach and the liver to the right side, to lie on the right side of the stomach, the same thing happens for the duodenum, so it loses its mesentery except the first inch of the duodenum. From the ventral bud, a ventral bud arises and dorsal bud, which we call it the ventral pancreatic and the dorsal pancreatic bud. At the angle between that bud and the duodenum, another bud arises which we call it the hepatic bud. The hepatic bud will divide into 2 other pars, a pars hepatica and pars cystica. That is the pars cystica, which will end to form the gallbladder, and the pars hepatica, which will end to form the whole liver. With rotation of the duodenum, the ventral pancreas, ventral bud, will come to lie behind, to rotate, to lie behind the dorsal bud. So the dorsal will be anteriorly forming most of the body and tail of the part of the head of the pancreas, while the ventral will form most of the head and part of the neck. At the meantime, develops a ventral and dorsal pancreatic ducts over here, and you have now, this is the common hepatic duct, which comes from the 2 lobes of the liver, and that is the cystic duct from the gallbladder. Both of them will form what we call it the bile duct. So this is the bile duct. With the rotation again, the dorsal pancreatic bud will continue sometimes to open in the upper part of the duodenum as accessory pancreatic duct, while the dorsal one will unite with the ventral pancreatic duct, and then with the bile duct form the another duct, which is the hepatopancreatic duct here, to open in the posteromedial aspect of the middle part of the duodenum on the ampulla of Vater. That is a summary of the changes of the developmental part of the duodenum. A rest of the process of vacuolation, which occurs in the second phase within the cavity of the duodenum, multiple small cavities coalesce to form a single cavity, which leads to an empty cavity, canalized one. A rest of this process will lead to what we call it atresia of the duodenum, which can happen to any part of the small intestine. Another anomalies could occur for the duodenum, as we will see, while rotation of the ventral and the dorsal buds. The ventral bud will rotate to come behind the dorsal, as we said. It may rotate around the middle part of the second part of the duodenum, forming what we call it annulus pancreas. So that is an overview of the development of the duodenum and its relation with the pancreas. Here is the end process after complete development of the duodenum and the pancreas and the biliary tract as described in embryology, to show that is the gallbladder here, that is the cystic duct, that is the pars cystica, that is the common hepatic, which join the cystic duct to form the bile duct, that is the pars hepatica, that is the accessory pancreatic duct, which drains mainly the head of the pancreas, but here it's a bit large and extend to the body, opens above the level of the ampulla of Vater by this blue pestle here, which can show the entrance of that accessory duct into the duodenum. That is the common bile duct, which unites with the main pancreatic duct here, forming what we call it the hepatopancreatic duct, opening in the posteromedial part of, that is the ampulla of Vater here, with the opening with that green pestle here coming out from the hepatopancreatic duct. That is the adult shape of what we have seen in the previous embryology. We will show two types of these anomalies of the duodenum. The one which we are looking at is the barium meal, showing an annular pancreas around the middle part of the second part of the duodenum, leading to very much narrowing of the second part of the duodenum. That is what we call it the annular pancreas. The other one, the other anomaly, is called whipping of the duodenum, and usually it comes pre the ampulla of Vater. It shows on the right side here bilateral gross, or you can say bilateral, not canalized parts of the cavity of the duodenum, leading to what we call it, that is a web, another web. Here there is a large web also leading to narrowing of the duodenum in the second part above the ampulla. That is less than atresia because it allows the passage of the fluid from the first to the second part. That's what we call it, webbing of the duodenum. As for the surface marking of the duodenum, we use 3 lines: the middle line, the transpyloric plane, which pass by the body of the first lumbar vertebra, and the subcostal, which pass by the body of the third lumbar. So the first part is almost half an inch to the right of the middle line and go for 2 inches, while the second part descends downwards parallel to the middle line for 3 inches to reach the body of the third lumbar vertebra, where the third part will start and will be for 4 inches along the body of the third part of duodenum along that subcostal plane. The fourth part will ascend upwards for 1 inch parallel to the middle line, where it terminates by this duodenal flexure. That is the surface marking of the duodenum. For the relations of the duodenum, we'll start by the first part, which begins at the continuation of the pylorus and ends at the neck of the gallbladder. Usually is divided into 2 parts. That is the first part here, into a first inch and second inch. Starting by the first inch, it follows the stomach in its peritoneal covering and relations and the blood supply, and the only mobile part of duodenum, which is called the duodenal cap. That first inch gives attachment superiorly to the lesser omentum, inferiorly to the greater omentum. Anteriorly, the quadrate of lobe of the liver will be anterior to it, while posteriorly separate from the neck of the pancreas by the cavity of the lesser sac. That's for the first inch. As for the second inch, it's a fixed part like the rest of the duodenum. It is covered only by peritoneum from the front and the sides. Its relation superiorly is to the neck of the gallbladder, that is the neck of the gallbladder. Inferiorly will be the head of the pancreas, that is the head of pancreas over here. Anteriorly will be the fundus of the gallbladder, will be covering anterior to it. Posteriorly will be the gastroduodenal artery, the common bile duct, and the portal vein. These are the relations of the second inch. The second part of the duodenum, which descends from the level of the neck of the gallbladder to the lower border of the third lumbar vertebrae, will be related anteriorly to the right lobe of the liver, which is marked here by these lines, the transverse colon, and the jejunum at the lower part. These are 3 bars for the liver, the transverse colon. All this area will be filled by jejunum. Posterior to the second part will be the hilum of the right kidney, will be the right renal vessels, the vein and the artery, will be the edge of the inferior vena cava, the right edge of inferior vena cava, and the psoas major muscle. While laterally will be the capsule of the right kidney and the right colic flexure, that is the right colic flexure here. While medially will be the head of the pancreas and the termination of the bile duct, that is the bile duct which passes deep to the second inch and then deep to the head of pancreas to reach the second part. That's the relations of the second part. As for the third part, which pass horizontally, we call it the horizontal part, anterior to the body of the vertebra, number 3, lumbar vertebrae. Anterior to it will be the root of the mesentery, containing the superior mesentéric vessels, coils of small intestine, which fills all this area, as we said, between the ascending colon, descending colon, and transverse colon. All this quadrangular area will be filled by coils of jejunum That's part of it, which will be also anterior to this part, the horizontal part. Superior will be the head of the pancreas and the unslate process of the pancreas. Inferiorly, over here will be, as we said, the coils of jejunum. The posterior relation of the third part of the duodenum, which is marked here by these dotted lines, which pass anterior to the body of the third lumbar vertebrae. Posterior will be from right to left, will be the psoas major muscle, the right ureter, the right gonadal vessels, the artery and the vein is down here, the right genitofemoral nerve, the inferior vena cava, the abdominal aorta, and the origin of the inferior mesenteric artery. That is the third part. Finally, the relations of the fourth part, which ascends on the left side of the abdominal aorta to reach the level of the second lumbar vertebrae, then turns ventrally to form the duodenal flexure. Anterior to it will be the transverse colon, which crosses the second part, the head of pancreas, and then the fourth part to reach the kidney, forming the left colic flexure. The left sympathetic chain will be again deep to it. The left psoas major, that is the jejunum here, the left psoas major will be deep to it. The gonadal vessels, the artery and the vein. The left renal vessels will be almost deep to the upper part of it, with the inferior mesenteric vein reaching the splenic vein. Medially will be the abdominal aorta to it, while laterally will be the left kidney and the left ureter. Superiorly will be the body of the pancreas. That is the whole relations of the four parts of the duodenum. Now for the blood supply of the duodenum. The blood supply, that is the celiac trunk here, that is the common hepatic artery, which will give the right gastric. We said the first inch will be like that of the stomach, so the right gastric will be as a branch from the common hepatic. The gastroduodenal, which pass deep to the second inch of the first part, will give the right gastrobuloic. This is exactly like the stomach. The gastroduodenal will continue to give the superior pancreatic duodenal, which divides into two branches, anterior and posterior, between the head of the pancreas and the duodenum, and the superior mesenteric artery will give the inferior pancreatic duodenal, again two branches which are smooth with the other two branches of the superior, and lastly a branch from the first jejunal artery of the superior mesenteric artery. Now, as we can see, that is the line between the foregut, which is supplied by the celiac, and the midgut, which is supplied by the superior mesenteric. That is the blood supply. As for the lymphatics of the duodenum, they run into anterior and posterior pancreatic nodes, which lie between the head of the pancreas and the duodenum. These nodes will drain into the following nodes: into the hepatic nodes, the pyloric, the pancreatic duodenal, and the superior mesenteric nodes. That is how the lymphatics will end up in these nodes. For the innervation of the duodenum, it has a sympathetic supply where the pregangular fibers originates from the segment number 5 thoracic to number 12, and they travel via the greater and lesser splanchnic nerves to the celiac ganglion. The postganglionic will be distributed through the branches of that plexus through the celiac axis and superior mesenteric artery. The blood supply of the duodenum comes from. The function, the vasoconstrictor to the duodenal vasculature and inhibitory to its musculature. The second is the parasympathetic supply, which comes from the vagal axon, which is distributed via the celiac plexus to the same parts along the arteries to the duodenal wall in a ganglia embedded in the duodenal wall. The function of the parasympathetic is secretory motor to the mucosa and motor to the muscles of the duodenum. Thank you for your attendance and listening, and see you in other videos.